News 8 is honoring the remarkable women in our community. The individual we're highlighting today holds a number of degrees in the healthcare field, but social justice is Dr. Celia McIntosh's passion.
That passion has led her to serve on many advocacy groups in our community, and it all began in 2014 when she was walking the halls of Rochester General Hospital.
I was walking into work and I saw the coalition had a table out and they started talking to me about human trafficking, and I was like, what? I was blown away because I didn't realize someone could trick you and force you to have sex with 10 to 15 men a night. You know, so it was just such a heinous crime that I couldn't unhear it, I couldn't unsee it.
Dr. Celia McIntosh says when she learned that 88% of human trafficking victims come in contact with healthcare providers who aren't aware of the signs, she sprung into action educating her colleagues.
So 9 out of 10 patients, you know, coming in contact with us, and we could not help them because we didn't know what the red flags were or the risk factors.
Dr. McIntosh became a member of Rochester's Regional Coalition Against Human Trafficking in 2014, and she served as president since 2016.
I say, you know, traffickers are led by PCR, power, control, and revenue.
She estimates the group has trained over 5,000 people in healthcare. They educate law enforcement and other community groups as well. The coalition also works to connect survivors and those at risk of being trafficked with the services they need to lead a successful life. When News 8 learned of her tireless efforts, we wanted to share with viewers some of what makes this advanced stroke certified registered nurse with a doctorate in nursing practice such a remarkable woman.
We haven't solved the problems of the social problems of the world that make people vulnerable.
She explains men, women, and children are most vulnerable to being trafficked when their basic needs are unmet. Things such as food, housing, education, and yes, love.
Because trafficking is hugely relationship-based. So someone could be filling a void. You know, one person specifically, this thing that I read, this article that I read, stated that this girl, her trafficker was the first one to buy her birthday cake.
As a result, McIntosh has a seat at the table of many other groups, including the Black Nurses Association, Police Accountability Board, and the Food Policy Council.
When I got involved in doing this advocacy work, that's when I realized that human trafficking doesn't happen in a vacuum.
Dr. McIntosh is so passionate about making a difference that she's adjusted her work schedule so she can be available during the week for meetings and other advocacy events.
When I actually obtained my doctorate, one of the focus of it was to improve population health. And I feel like, you know, when we think about if I'm improving someone's life, someone that's being trafficked, or improving the resources, then having access to equitable resources, then I can have the potential to improve generations. Get my skinny side.
Dr. McIntosh colleagues on the Coalition Against Human Trafficking say they wonder if Cecilia has time to sleep. And here's another example of their work. Dr. McIntosh and the Council Against Human Trafficking are working with a local beauty school to host a class to train cosmetologists about human trafficking awareness. Miss Julia's School of Beauty is a nonprofit cosmetology school that will provide vocational training to survivors of human trafficking. The beauty school is hosting a training session on Monday, March 28th to educate others about how traffickers use the industry. The training is from 7 to 8:15. We have a link to the register for the free event at rochesterfirst.com.